Jared Hawkins is the Home and Community Extension Assistant Professor in Summit County. He's a licensed associate marriage and family therapist. He's completing his PhD in couple, marriage, and family therapy from Texas Tech University and will defend his dissertation in June. For his dissertation, Jared interviewed young adults about their experiences of sense of community and loneliness and how these experiences influence their mental health. So we're super excited to have Jared on, and thanks so much for presenting for us.
Yeah, thank you for this opportunity. Let me see if I can share everything. Okay. Can you all see my slide in the right view? Okay.
Yep, it looks good.
Okay, awesome. Awesome. Well, I'm thrilled to talk about social support in regard to the work that we do. And we talked about how February is like relationship month and Valentine's Day. And so we talked about how can relationships play a part in what we do. And the more I thought about it, the more I researched, the more I realized that, wow, there's a lot that we can do in terms of social support for the people we work with. So my message today is that ambassadors and supervisors will be more effective if we help the people we work with to increase their social support. And so my presentation today will hopefully convince you of the importance of bolstering social support for the people we work with. And I'm gonna try to convince you of this with 4 main points. So one is that loneliness, one is really a huge health problem, and it also influences poor nutrition behavior. 2, social support makes it easier for people to make positive changes in their nutrition behavior. 3, ambassadors are in a pretty good spot to actually help their people they teach to increase their social support. And lastly, ambassadors will be more effective if they're more supported. And so what can we do to increase their support? To start, let's talk about loneliness. So I study loneliness for my dissertation. I love talking about loneliness, which sounds super weird. No one likes talking about it, but I love talking about it. So really happy to give this presentation. Okay, to get started, take a look at these carrots and just notice how much you are like craving them by looking at them. Is your mouth watering? Are you like really, gotta have some carrots right now? What about now? So you look at these like crispy, salty fries and this like mouth-watering burger with like melted cheese and crispy bacon and like sweet tomato, like greasy bun. How much are you craving that? Is your mouth watering yet? And what about this? Maybe it's a sweet, chocolatey, soft donut, or a really sweet, refreshing Coke. And sorry, I know we're supposed to be promoting good, healthy choices. Sorry, I'm tempting all of us. But compared to the carrots, like what actually just, in fact, I'd love if you could put in the chat of the carrots, the burger, the fries, the drink, or the donuts. What got you like craving it the most? What got your mouth watering? What do you really want right now? Go ahead and put that in the chat. Burgers and fries with the little brownie face. Donuts. So it looks like the burger and fries really calling us. Yeah, sorry everyone. Sorry to make us all hungry. Okay, well, so no carrots, huh? Well, I think most of us are pretty familiar with the idea that humans evolved to crave high caloric foods because that's what kept humans alive. But like our anciently evolved bodies living in a modern world creates some issues, right? So now we have all these health problems because we developed these evolutionary responses, but now we live in a world where we can go get donuts every day if we wanted to. And there are a lot of things like that, a lot of health issues like that, like, you know, not exercising, not moving around very much, not being connected to nature, being chronically stressed, being on technology all the time. There are a lot of lifestyles in our modern world that are different than how humans lived for most of human history. But I want to talk about one of those discrepancies today, and it's no surprise, loneliness. So like the cravings for high caloric food, loneliness is a survival response because connection kept humans alive. And so again, the discrepancy is for most of human history, humans lived in tight-knit groups and they worked together, they cooperated, and they were in these same groups for their whole lives. Now, modern trends are diverging quite a bit from that. People are living alone more often. They are marrying less, having fewer children, living farther apart from their networks, communicating more online, becoming less involved in community and religious organizations, and the list goes on. So that's why loneliness has become an epidemic because of these modern differences, you know, amongst other things. And so what's the result of that? Is being lonely that bad? A researcher just a few years ago said that lacking social connection carries a risk that is comparable and in many cases exceeds that of other well-accepted risk factors, including smoking up to 15 cigarettes per day, 15, obesity, physical inactivity, and air pollution. So some of the big health issues that we have today, loneliness is up there, or maybe even is above those. Like, wow, how can loneliness be that bad for you? Does that make sense? Well, here's just a brief explanation. Loneliness is a stress response. And so if you think about kind of the fight or flight stress response that we have, you know, in early human time, if they confronted a lion, your body has a stress response, it kicks in, puts all of its energy into short-term survival. And then, you know, when hopefully if you don't get eaten by the lion, then when you're safe, your body calms, and then your body kind of re-puts its energy into long-term survival. And so loneliness is similar in that it's a short-term survival response, it's a stress response. And so people who are chronically lonely, their body's putting energy into like short-term survival, and so it's not putting its energy into long-term survival. So, you know, basic health stuff like your immune system. And just to be clear about this isn't to say that if you're alone, you're lonely, right? You can be with people and be lonely, and you can also be alone and not be lonely. Loneliness is usually described as the discrepancy between what we want and what we have. And so if there's a certain type of connection that you feel like, you know, you really need, really want, but you don't have that, then that's when you have that physiological reaction. So who's at risk for loneliness? Here are some of the main risk factors. Older adults, you know, there's a ton of research about that. We kind of assume that. But surprise, young adults are actually, there's some studies that find that they're even more lonely than older adults. And you're like, how can that happen? Because young adults are like with people partying all the time. Well, Perhaps it's, that discrepancy. Maybe they want to be married, but they're not. Maybe they want to be with family, but they're living away from family. Maybe they don't have, my dissertation is about how young adults experience a lot of network instability and lack of stable communities. And so that's a big, anyway, being a young adult is a bigger risk factor. A lot of the other ones are intuitive. If you're widowed, divorced, or unmarried, if you're living alone. Wow, lower SES. So the people we serve have a risk factor of loneliness. Migrants, those with physical and mental health issues. Actually, in my county, in Summit County, low income was actually the biggest risk factor. So it may differ in your counties, but and you also see the young people are the second highest risk factor.
Jared?
Yeah.
What does SES stand for?
Oh, sorry. Socioeconomic status.
Oh, okay, thanks.
Yeah, so low income would be one of those risk factors. And so you might be wondering, okay, maybe loneliness is a big health problem, but what does that mean for me, right? I'm a nutrition educator. I'm not here to help people become less lonely. So what does it have to do with me? The Human Resources and Services Administration said that as a force in shaping our health, medical care pales in comparison with the circumstances of the communities in which we live. Few aspects of community are more powerful than is the degree of connectedness and social support for individuals. So if we're trying to help people be healthy, kind of social support, social connection is a big deal for us. And the other thing, again, is that many of the people we serve are lonely. The other reason is that turns out loneliness and poor nutrition behavior are actually connected. And so say I'm a lonely young adult and, who's like really wanting more connection and I don't have it. I'm in kind of that short-term, I'm having that stress response of loneliness, puts me in short-term survival mode. And in that mode, what kind of food are we craving, right? When we're in survival mode, we crave high caloric food, right? And so people who are lonely are more likely to want and to want those kinds of foods and to have more difficulty in making long-term health decisions. So eating, fruits and vegetables. So if stress factors like loneliness lead people to make shorter-term health choices, the question is, okay, if we can help people increase their social support, I wonder if that would help them to make better healthy choices. So I wonder if, we're providing this education about how to eat healthy, right? How to be healthy. I wonder if we help them increase social support, if it'll be easier for them to make healthy choices. So I out of curiosity, I looked at a few research studies and found that the answer to that question is yes. Social support does make it easier to make positive changes in nutrition behavior. In this study, they reviewed 35 other studies, and they found strong evidence that social support is a predictor of fruit and vegetable intake. Many other studies showed this correlation. Received social support is connected to healthy eating. What's more than that, though, is that there were many studies that looked at, okay, let's provide an intervention of providing nutrition education or something like that to help people make healthier food choices. And many of these studies found that by incorporating some element of social support, that those interventions became more effective. So whether it was a buddy system or other other ways that they tried to incorporate social support into their interventions became more effective because of incorporating social support. So what does that mean for us? Does that mean that, okay, we know that loneliness is really bad for you. It influences healthy food choices. And we know that social support helps us make healthy food choices. So what does that mean for us? Can we help our students to make healthy food choices by increasing their social support? Is there something that we could do that'll make it easier for them to adopt what we're teaching if we incorporate this element? And if there is, then like, how do we do it? So I don't know. Like I've actually never been surprised, never been a Create Better Health ambassador. I don't even have one. We're still trying to recruit one, and I'm pretty new, and so I don't know. And so in a few minutes, I'll have us get into breakout rooms and maybe brainstorm some ideas. However, I did look at a few other research studies and found some ideas that other nutrition educators, other organizations did with their interventions to incorporate social support. So here are a few ideas. The big first idea is to help your students use existing networks. How can they draw upon the people they already know to provide social support to the changes they're making? So that could look like maybe during your lesson or during your discussions with your students, you could help them identify people who could support them. Who in your life could help you? What support do you need first? Do you need encouragement? Do you need resources? What do you need? And who in your life could help with that? Who in your life could help you make these changes? You could also encourage your students to invite friends and family to join the classes. That way, there are people in their lives who are involved in the changes they're making. They know what they're trying to do, and they're with them. You could encourage the people you teach to go back into their groups, go back in their friends and families, and promote these nutrition things they're learning, right? To become educators themselves and social supports to other people. Maybe you could host classes that are targeted to specific groups, right? Instead of individuals, you're hoping to get full systems in the room, right? Maybe you present certain organizations, or you have like a family class that you do. And then maybe you encourage your students to host social gatherings. And so we know that meals are a cultural gathering, like a social gathering across cultures. And so you could encourage them to gather people around them for these changes. So anyway, some ideas from a couple of studies to help people use their existing networks to help them, as support for their nutrition changes. Another big idea that was thrown out in some of these studies is to help your students identify new networks of support. And I think the biggest one for us would be to make our classes a new social support system for our students. And we can do that by facilitating interaction and support in our classes. So think about if I'm a lonely young adult and I walk into this class, I don't know anyone, but I'm like, I probably should eat better and want to learn about that. How amazing would it be if I walked out of that class feeling supported by the other people in the class? I feel a sense of solidarity, like we're all in this together. We're all trying to make healthy food choices. Maybe I'm even becoming friends with some people in the class. Yeah, how amazing would that be if our classes became new systems of support for our students? Some studies found that having a mentor buddy system really helped. Providing culturally sensitive information, their language, helps them to have support or like the information will be relevant to them and their social circles. And so that helps a lot. Maybe you can involve people in the community or your students in helping to teach, or maybe, and so those are all things that you could do to help them, help your class be a supportive environment. But maybe you could also connect them to other organizations to help them find other support. This study provided a lot of suggestions for facilitating class discussions. And so their main point was, yeah, nutrition education is more effective if we make it a discussion, right? People are involved. And so they give ideas about how to have those types of discussions. Feel free to look up that article if you're interested. But yeah, just some of the basics of like running discussion groups. So, and then in our PSE efforts, there are definitely things that we can do to increase social support from a more holistic level. So we could advocate for better social norms. There's a study that found that it's a lot easier for people to make health decisions if it's kind of the norm. And then I think the big thing is that we can somehow help improve social support for at-risk or marginalized groups. And so I'm not sure how to do this the best way, but whatever we can do to increase social support for the people that we're serving. Okay, so those are just a few ideas I found in some research studies, but now I really want to hear from all of you. What things have you done already that have helped your students increase social support? And then maybe what ideas do you have for the future? So I would like us to spend about 10 minutes in breakout rooms of about 4 each. And just as, you might be in there with an ambassador, supervisors or other people from Create Better Health. And so I think maybe we'll all have different ideas and perspectives. But yeah, let's talk about, just brainstorm some ideas for 10 minutes. What can we do to increase the social support for our students, knowing that it makes a big difference? Am I allowed to put people into breakout rooms? Oh, I think
you should be able to. If you need me to, I can do it real quick.
Oh, I think I got it. Perfect. Okay, I'll see you back here in about 10 minutes. All right, welcome back. We're still waiting on a couple groups to come back. So we'll start here again in about 30 seconds. Okay, yeah, welcome back, everyone. I just popped into a few of the rooms and heard really great discussion. And so, so I'm excited to hear some of your ideas. I would love for anyone to share if you heard any good ideas in your groups or things that you may want to try to, keep increasing the social support of your students. Would love to hear that. So anyone can jump in for the next 5 minutes, and I'd love to hear your ideas.
Well, I can speak to what we talked about in breakout room 4. So in our group, we had myself and then 2 supervisors and Paola, who is one of our program leads for the Hispanic programming. And so we kind of broke it down because we had 2 rural county supervisors and Paola. And with the Hispanic population, Paola mentioned how important it is for people to feel understood and that our ambassadors have compassion for where they've been and their experiences, and that we show that empathy and use that to create that relationship and that trust with them so that we can help them understand why those long-term decisions and health behaviors are important. So just making connections with them at a level of understanding and understanding where they're coming from. And then for rural populations, community programming and facilitating the relationships that come with those communities. And both supervisors mentioned the importance of having a positive space for people to come and together and making sure that it's a positive experience for everyone that's participating so that they can connect and have time together to foster those relationships and those connections.
Great, thank you. Yeah, those are great thoughts. Yeah, thank you.
We talked about having like a family night kind of a thing where we
Michelle, it's, at least for me, it's pretty quiet, so I can't really hear you.
Can you hear me any better now?
Like a little bit better.
How about now? Is that better?
Yeah, we'll just turn I'll just turn my volume up. And
okay, well, hopefully that's better. That's the best I can do.
Okay, yeah, no, that's great. Yeah, no, that's great.
We talked about the possibility of having like a family night where we invite our participants to participate in a family night. And if you have enough ambassadors in your county, you can have like split up into sections where the kids go into one group and you can teach like our kids curriculum, and then you can do the adult section where you teach the adult curriculum. And that way the adults can kind of have connection with what their spouse is doing, as well as like with the other people in that group. And then their kids can also have time together with other kids and learning and having that social time together.
Good. Yeah, I love that. Thanks. I love that. Thanks. Great ideas. What other ideas did you talk about in your groups?
We talked about maybe doing like a buddy night and have like out at the senior citizen center and have the older people pair up with maybe a younger adult, because the older people can really teach us a lot and help us a lot. And there's some good friendships there.
Yeah, I like that. Thank you. Yeah, not only are you incorporating a buddy system or a mentor system and learning, but you're also helping marginalized or like lonely populations connect. So I love that. Yeah, other ideas?
So in our group, we talked about using, this is Kara from Uena County that does this. She opens a private Facebook group for the people that participate in her adult curriculum classes in those series, and they can go on there and talk with each other and share recipes and stay connected. And I thought that was a really great idea, especially in areas where we're so rural, that it can help people stay connected even though they can't physically be together sometimes.
Oh, I love that. Yeah, that's great. Let's just keep, there's so many good ideas. Let's keep these coming.
I shared in breakout group 7 how in the past I've had the opportunity to teach at community sponsored events like West Jordan City did like a Biggest Loser, and Magna City has like a movement group. And so if you can make connections with organizations like that or city-based programming where people are already kind of coming together with like-minded ideas and like-minded goals, you can be that nutrition education arm of that. You know, maybe they don't have that, but you're already kind of, there's already a well-established community connection or a program's already put together with people with like-minded goals. And then if you can reach out to that organization or that community event, then you could potentially have a big impact because there's already people who are in that, you know, behavior change, you know, step where they're ready to make changes.
Yeah, good. Yeah, another great idea. Okay, maybe we'll take one more.
I'll share something that I saw on Facebook. So it wasn't discussed today, but I loved it. Amber Lee, when they were doing their Farm Fresh Gardens classes, they would do the recipe on Facebook, record it, and then they had a find Captain Create. And so Captain Create was, you know, in a fairly obvious location, but then that got the families watching together, looking for Captain Create. And then the following week at the class, then they, you know, ask the kids where Captain Create was. So that was a great way to engage families to be together and watch the classes together. And then of course, when they all got to the garden the next week, I'm sure that they all shared it and visited about that video too. So I thought that was a really good idea.
Good, thank you. Okay, awesome. Yeah, really, really great ideas. If you haven't already, you know, go ahead and jot down something that you heard that maybe you want to try in your county. But yeah, thank you so much for sharing. These are awesome ideas. And yeah, definitely stuff that I wouldn't be able to come up with because I haven't done it. So that's great. Okay. Well, let's wrap up with our last point. So we talked about how important social support is in making healthy choices for the people we teach, but it's also very important for ourselves, right? For our ambassadors, supervisors, anyone who works for Create Better Health, we will all be more effective if we are supported. And so let's talk for a minute specifically about ambassadors. You know, because you know, supervisors, it's kind of your role to provide the support, and yeah, obviously they'll be a lot more effective with your support. So my big question for you is, ambassadors, if you think about some of the issues that you're running into in your county, some of the struggles that you're having professionally, think about what support might help you with those struggles. So what could you ask of maybe your supervisor or another Create Better Health leader, or maybe support from some organization or someone in your community? What support do you feel like you could use to help you with maybe any issues that you're running into? So I'm actually going to put you into breakout rooms, maybe just for 5 minutes this time, just so we get some more ideas flowing about the types of support that we can draw upon to face some of the issues that we have. So with that, let me put you into breakout rooms of some people, and then I'll see you back here in about 5 minutes. And again, the prompt is, ambassadors, what type of support do you need, from anyone within the organization or anyone in the community? What support do you need to be successful? And if you're a supervisor or Create Better Health leader, this is also time for you to think about, what kind of support can you provide, and also learning from the ambassadors, right? What's helpful from you? What are you learning? What are you hearing the ambassadors say is helpful type of support from you? So what can you provide? So I'll see you back here in about 5 minutes.
Heidi, since I have you here for a moment, how many households were served yesterday? Hurry and put that down.
Okay, welcome back, everyone. Again, I heard really great discussion in some of the groups I popped into. And let's see. Let's go ahead and close this out. I have an invitation for each of you. If you're an ambassador, I would take some courage, and next time you meet with your supervisor, maybe suggest or ask for one type of support. And so as you've been thinking about maybe some struggles that you have or some social support that you need, would love next time you meet with them to be like, hey, you know, we had this social support thing. They asked us to think of something that you can do to support me, and maybe here's one thing that you can do to support me. Supervisors, same thing. So next time you meet with your ambassador, ask, you know, what's one thing that you can do to better support them. So I think having those discussions hopefully will produce some good ideas for how you can better work together and feel more social support. Again, because the more that you feel supported, the more successful you will be. Okay, to wrap up, we're all in this together. If you're an ambassador, I think a worthy goal is to help your students increase social support, because as I discussed, with more social support, they'll be better able to adopt the changes that you're inviting them to make. And you can also help them reduce loneliness, which is a big health risk. Supervisors, there's a lot that you can do to support your ambassadors. And so, yeah, I encourage you to have good conversations about that so that you can provide better support. So with that, yeah, thank you for listening, and I hope that we can all continue to work together to help promote healthy behavior, because we can't be healthy alone. So thank you again. Here are some studies that I referenced in case you're interested. And I'll send out I think it's just like a 4-question survey about this training. And so I'll send that out right after, and would love for you to complete that. So, hey, thank you.
Thanks so much, Jared. We really appreciate it. For everyone else, we will put the recording up so you can go back and look at those references as well, and make sure you respond to Jared's survey for him. We really appreciate it, everyone. Hope you have an amazing rest of the week, and we'll see you next time.